around me.
Okay, you guys we need to get rolling. Okay, lower back, lumbar. First test is the straight leg raise, also known as Lasegue's test, and we're looking for Lasegue's sign. The straight leg raise is with the patient in a relaxed position. You want to have the patient lift their leg actively, so go ahead and lift your leg up for me. See how well they can do. All right, so obviously no problems there. Okay. For a patient who has sciatica or has disc impingement or has some other type of low back disorder, usually they will not be able to get up past 30 degrees without significant pain. 30 degrees is your cutoff.
So
that's what we're shooting for, is 30. All right? So ask them to do it actively to see what they can do. And if they go, oh, I can't do it, or I can't lift my leg any further than that, then okay, fine. Now what we're going to do is we're going to do it passively. So I'm going to lift your leg up. Tell me when you start to experience pain. Ouch. Okay, so now what we're going to do is we're going to measure this angle. So it's greater than 30. It's not quite 45, so we're going to say it's about 40 degrees.
no goniometer.
We can definitely get out our goniometers, which I don't happen to have on me at the moment, but we can definitely measure that angle. Okay? More often than not, it's going to be guesstimated. You'll get better at guesstimating. It doesn't have to be exactly. Well, it's 42 degrees. All right. This is the straight leg raise. It's also done on the opposite side. Okay, both sides need to be done for potential nerve root impingement. And if you do it on the opposite side and they get pain that radiates down the same affected leg, then that's considered a positive sign. If they get pain down on that leg, then they may have impingement on both sides. So you need to check for both. All right, now the next test is called the Bragard stretch test, which is part of the straight leg raise. This is Lasegue's. So once she says, I have pain at this point, that's a positive Lasegue sign. What I'm going to do at this point is I'm going to lower the leg down to the point that the pain goes away. So the pain is gone. Now I am going to forcibly dorsiflex the foot in an attempt to reproduce the pain, because this will cause stretching and that will reproduce the pain. So pain here, lower down to no pain, dorsiflex the foot, and reproduce the pain. That's Bragard stretch. Okay? Any questions on those? The next test is the bowstring test. For this one, place the ankle on your shoulder, flex the knee to about 15 degrees, and you want to apply direct pressure to the popliteal fossa. And it doesn't have to be forceful pressure, just squeeze it in the back. If this causes pain in the back of the knee area or in the back of the thigh, then that would be an indication of tibial nerve root inflammation. So we can kind of differentiate between sciatic and tibial nerves. This is bowstring, but a knee has to be slightly flexed and pressed in the back. All right, last test is the Hoover test. Remember we said this was a test for distraction or malingering. Let me explain this test to you. This is when a patient comes in to you and says, I can't move my right leg or my left leg. If they can't move either leg, if they walked in and can't move either leg, they're lying. All right? So, if they come into your clinic or ER and they say, I can't move my right leg. I'm paralyzed here. All right? This is basically a test to measure how factual that is. So if I place my hands underneath the patient's heels and she says, I can't move my right leg, I say, okay, all right, well, let me just see what you can do. So try and lift that right leg for me. And the person who's trying to convince you otherwise that, you know, their leg is paralyzed will make no attempt to lift. How you'll know that is you won't feel any change going on the opposite side. Even if they attempt to lift this leg, if they make any significant attempt, they're going to have counterforce applied to the opposite side. If they don't, that's fine. Now what you do is you do the same thing. Okay, now I want you to lift your left leg. Now when they lift their left leg, if you feel them push down on your other hand, they are not paralyzed in that leg. Okay? So if they lift up on this leg and you don't feel them pressing on this hand, then okay, maybe they are. Maybe there is significant enough impingement that they're not able, or they've got very weak hip flexors, one or the other. But all it is a test basically for malingering, but you can test the hip flexors as well. But when you're back there, try this. Try to lift one leg without pushing down on the other. It is almost impossible to do. You have to be pretty talented to get away with that one. So you want to feel for it. All right? So that's Hoover's. Any questions on that? Okay, while you're in this position, I'm going to do Gaenslen. Okay, Gaenslen's is a test for sacroiliitis. What you want to have the patient do, patient says, I have pain radiating down my right buttocks, or I have pain deep inside my right buttocks area. And you suspect that the patient has sacroiliitis. One of the tests, and the predominant test that you're going to do for this is called Gaenslen. So if it's the right leg, have the patient roll up on their left side. So roll up on your left side for me, and I want you to take your left knee, tuck it up to your chest, and hold on to it for me. Okay? Now, what I'm going to do is I'm going to stabilize this hip, and then I'm going to hyperextend it. By hyperextending it, I'm putting a lot of pressure back in that sacroiliac joint. And that's going to reproduce that pain or exacerbate the pain that they're having. So this is Gaenslen's test. You can also do this by having, go ahead and lay on your back, by having the patient slide all the way over to the edge over here, and then bring their hip down over the edge of the table like this. This also, but my only concern with this is the table edge puts a lot of pressure on the back of their backside, and sometimes that can be a little uncomfortable. So my recommendation is roll them up on the unaffected side and then hyperextend the affected hip. All right, let's see. Joint stability or telescoping. What we're checking for here is we're checking for hip dislocation. All I'm going to do is bring the hip up to 90 degrees of flexion, and I'm going to press down on it using adequate force in an effort to try and slip that femoral head out of the acetabulum. So I'm going to apply enough downward force to do that. I can also do distraction and have a lifting force on it, and to see if that hip joint will slide up or down in its normal process. Now, in a healthy young person, it's not going to happen.
Why? Is that somebody who has hip problems, like it's just slipping out of the joint?
Yeah, someone who says, I feel like my hip keeps kind of popping out of joint or whatever. They may have some strained ligaments around that hip joint, so you're basically just checking for laxity within that hip joint. Or you can check for actual hip dislocation by doing that, but it's not usually recommended. And if you suspect that the patient has a fracture, don't do that. Okay, you do not want to drive the femur down into itself. All right. Stand up for me, please. Trendelenburg we talked about in class. Okay, I'm going to put your backside on big display here. All right. What you're going to ask the patient to do is lift one leg and stand on the other leg for me. Okay? And what we want to notice is when she does this, that her hips remain parallel. Okay? So when she's standing on one leg, she should be able to do this, and her hips should remain straight. If she has weakness in the gluteus maximus on the side that she is supporting the weight on, then her pelvis will tilt in the opposite direction because she's unable to support herself on this side. Okay? Does everybody understand that process? Has nothing to do with this side. Has to do with the strength of the gluteus medius on this side. Same thing, stand on the other leg, stands on that leg, same thing. Pelvis should remain straight. If pelvic tilts, then she has weakness in this gluteus medius muscle. Make sure everybody understands that. Now we have the Flamingo. The Flamingo is basically the same test, only this is not a test for gluteus medius. This is just a test for sciatic or SI joint pain. And all you do is have the patient stand on one leg and stand on the other leg and see if it causes pain in the backside. It's a very simple test, not a whole lot, but that's the Flamingo test. Now we're almost done. What else do we have here?